Now, Singapore's health ministry says the 3 recent cases of tuberculosis at Bedok Town Secondary School are not linked to each other. It described the incidents as a coincidence. Sarah Gross with more.
3 cases in the last 5 months, but the cases are not related. The health ministry says they're independent of each other. The tuberculosis control unit screened about 180 teachers and students who had been in close contact with the first 2 infected students. Some screened tested positive for the latent form of the disease and were offered an anti-TB drug to reduce their risk of developing the disease. About 40 who had close contact with the 3rd student will be screened after the O-level examination in the middle of November. Now, it's important to distinguish between those who have tested positive for a latent tuberculosis infection and those of an active tuberculosis disease. Those with a latent infection don't have any symptoms and aren't contagious, and only a small percentage of them will develop an active TB disease in their lifetime. The TB control unit says screening those who were in contact with TB cases is better than a mass screening.
When you apply a test, you have to apply a test to a high risk, high prevalence of the condition group. If you apply a test to a low risk group, in other words, the prevalence of the condition is low in that group, you will throw up more false positives.
The health ministry also stressed that Singapore residents still form the majority of TB cases in response to a news report that highlighted foreigners as contributing to TB cases here.
The numbers that are quoted and published there include a whole lot of very short-term visitors, applicants for work passes who are rejected and go home, persons who specifically come to Singapore for TB treatment, So these numbers should not have been included in a comparison with the resident population.
The ministry also said Singapore's current TB cases mainly come from older people who have a weaker immune system.